A recent report from the American Cancer Society found that between 2012 and 2021, the rate of breast cancer in women under the age of 50 actually rose 0.25% every year. Asian American and Pacific Islander women had the biggest increase, 2.5%. While the death rates have dropped in the past 30 years, black women still have a higher risk of dying than white women, even though they are the least likely to be diagnosed. Dr. Susannah Hills is a surgeon at Columbia University Medical Center and a breast cancer survivor. She joins us now to talk about some of these numbers. First of all, thank you for being here.
Oh, I'm thrilled to be here. Thanks for inviting me.
So let's talk about what we're seeing more recently. Younger women under the age of 50 being diagnosed with breast cancer. Why is that?
I think really, in part, it's a reflection of the fact that we're getting better and better at diagnosing cancers earlier. So we're good at determining by blood test screening, family history, who's at higher risk, and then getting younger women who are at higher risk screening tests earlier. So we're seeing more and more young women, we're diagnosing them better. Also, I think it's important to just recognize that delaying childbearing, which is happening more and more as women focus on careers and other important things in their lives, also can have a little bit of a negative impact on breast cancer as well, because being pregnant and breastfeeding mitigates some of the hormones that can help breast cancer grow and spread.
Okay, so a study author says that 1 in 50 U.S. women will develop invasive cancer by the age of 50. Do you agree with that?
I think it's the very best data that we have. This comes from the SEER database, which is part of the National Cancer Institute. So it's really the best, most robust data we have. And sure, I think there's no reason that that we wouldn't think that would be accurate. The good news is we're getting better and better at detecting this earlier, and this is shifting our guidelines for this recommendation that mammograms be performed starting at 40 instead of 50.
So 40 has been like the magic number when it comes to mammograms, but does that differ now, especially if you're seeing women at a younger age and with family history?
Right. They just changed the recommendation to 40 years of age. It was 50. And on top of that, if you're at higher risk, you may need to get screened earlier if you have the BRCA gene or a strong family history of breast cancer or other cancers personally that you've had. Or they might recommend a different imaging modality like ultrasound or MRI. So 40 is for women at average risk, not an increased risk. And then if you have other risk factors, they may even recommend getting screened earlier or with different types of testing.
And is it generally still every year after that first initial
Yes,
test?
every 1 or 2 years, yep, after the age of 40. Exactly right.
Okay, so why are we finding that black women have a lower survival rate, even though they aren't as likely to be diagnosed?
Yeah, so I think clearly this is a reflection of the inequity that's built right into our healthcare system. Women who have less access to health care get diagnosed later. They get diagnosed with potentially more advanced disease, and we know that black and brown women tend to have lower access to health care, to insurance to cover treatment once they get diagnosed. So I think that's clearly one of the main reasons that we see this disparity, this inequity. On top of that, black women are more likely to have triple negative breast cancer, which tends to be a little bit harder to treat. Some of the medications that we use that are hormone-based can be less effective in that type of cancer.
You're actually a survivor. What was your experience and how was it detected?
Well, I was diagnosed very early. I had no risk factors, and I was diagnosed when I was 30. So one of the main things I took away from that experience was that this can happen really to anybody. It's important to know your risk factors, but it can happen to people without risk factors when you're not expecting it. It can happen at a time of life when you're trying to build a career or think about family, things that are very crucial in your younger adult years. So it can be very challenging for women when they're diagnosed at a younger age. I was initially misdiagnosed because I didn't have risk factors, and I was told it was a cyst. So another really strong message I would give to everybody is if you feel like something's wrong, persist. Make sure your doctor's paying attention. And if you feel like they're not, get another doctor who's going to listen to you.
Keep advocating for yourself.
Yes.
Well, doctor, thank you so much for joining us.
My pleasure.